Hello, dear friends, and welcome back to Wellness Hub Seniors. Today, we are going to gently explore a topic that touches almost all of us. As we gracefully age, the mystery of sleep. Have you ever wondered why something as simple as a handful of nuts might be the quiet reason you wake up 2 or 3 times every night? It sounds small, doesn't it? But for many elders, this gentle evening habit is silently disturbing your precious sleep. You go to bed after a long day, truly hoping for peaceful rest. But your bladder, it seems, has other plans. The night becomes a series of gentle interruptions. Your sleep breaks, your body feels tired, and those beautiful mornings no longer feel as fresh as they once did. But here is the hopeful part, dear friends. Some nuts can actually bring a sense of calm to the bladder, while others can quite subtly trigger it. In today's video, we will gently explore 5 types of nuts that truly support deep, uninterrupted sleep, and 5 you might consider avoiding after the sun sets. These are small changes, yes, but they can bring such great relief. Part 1. Understanding the why, the gentle shifts in senior sleep. First, let us talk about why these changes happen. It's not necessarily a problem, but rather a natural evolution of our body. Think of your body as a beautiful, intricate clock. As the years pass, some of its gears begin to turn at a slightly different pace. One of the most significant reasons for sleep changes is a quiet shift in your body's production of melatonin. Melatonin is often called the sleep hormone. It's your body's natural messenger telling you when it's time to wind down for the night, and when to wake up. As we age, our bodies simply produce less of it, and often later in the evening. This means your body might not get that strong, clear signal for sleep that it once did, making it harder to fall asleep and stay asleep. When we are young, our sleep is often a smooth, deep, uninterrupted journey through different stages. As we age, this journey tends to become more fragmented. We spend less time in the deepest, most restorative stages of sleep, those crucial periods where your body truly repairs itself and consolidates memories. Instead, we spend more time in lighter sleep-making. More susceptible to waking up from small noises, discomfort, or the urge to use the restroom. This fragmentation means you might be in bed for 8 hours, but only truly getting 5 or 6 hours of quality rest. Your body has an internal 24-hour clock called the circadian rhythm. This rhythm dictates your natural sleep-wake cycle. For many elders, this clock tends to shift, making you feel sleepy earlier in the evening and wake up earlier in the morning. While some enjoy being an early bird, sometimes this shift can lead to waking up at 3 or 4 a.m. with no chance of falling back asleep, which can leave you feeling unrested. We touched on this in our previous video, and it is worth highlighting again. As we age, our bladder and kidneys undergo changes. The hormone that helps us hold water at night, vasopressin, decreases, and the bladder becomes more sensitive. This often leads to needing to urinate multiple times during the night, a condition known as nocturia. Each trip to the washroom breaks your sleep cycle, making it harder to get deep rest. Our senses can become a little sharper during sleep as we age. A small creak in the house, a passing car, or even your partner gently turning over can be enough to pull you out of lighter sleep where you spend more time. This increased sensitivity means a truly quiet and comfortable sleep environment becomes even more important. Part 2. Common sleep issues and their gentle roots. Beyond these natural shifts, certain conditions or habits, often more prevalent in our golden years, can also gently nudge our sleep off course. Insomnia isn't just about not sleeping. It's a persistent difficulty falling asleep, staying asleep, or waking too early, leading to daytime fatigue. For elders, it can be linked to the melatonin dip, anxiety about sleep itself, or underlying health issues. It's like your mind just won't quiet down, even when your body is tired. Sleep apnea is a more serious condition, where breathing repeatedly stops and starts during sleep. It's often accompanied by loud snoring, and can leave you feeling exhausted even after a full night in bed. It's like your body is constantly jolting itself awake to breathe, even if you don't fully remember it. If you or your partner notice loud snoring followed by silences, it's wise to discuss this gently with your doctor. Imagine an irresistible urge to move your legs, often accompanied by uncomfortable sensations, like crawling, tingling, or itching, especially in the evening or at night. This is restless leg syndrome (RLS), and it can make it incredibly difficult to fall asleep or stay asleep. It's like your legs have a mind of their own. Just when you want them to be still, living with chronic pain, whether from arthritis, back issues, or other conditions, can be a major sleep thief. It's incredibly hard to find a comfortable position, and the discomfort can repeatedly pull you out of sleep. Finding gentle ways to manage pain during the day can significantly improve your nights. As we age, many of us take more medications for various health conditions. While these are vital for health, some can unfortunately interfere with sleep. Common culprits include certain blood pressure medications, decongestants, antidepressants, and even some over-the-counter drugs. It's important to gently review all your medications with your doctor or pharmacist to understand their potential impact on your sleep. Never stop taking a prescribed medication without consulting your healthcare provider first. Sometimes our daily lifestyle factors, though seemingly innocent, can quietly disrupt our sleep. This includes irregular sleep schedules, excessive napping during the day, too much caffeine or alcohol late in the day, or a lack of physical activity. It's like our body doesn't know when it's truly time to rest. Part 3. Gentle solutions, what you can do to reclaim your rest. Now for the hopeful part, dear friends. Understanding the why is the first step, and the next is discovering what you can do to gently guide your body back to more peaceful nights. These are not drastic measures, but loving adjustments to honor your body's new rhythm, or what to do, gentle habits to embrace. Try to go to bed and wake up around the same time every day, even on weekends. This gentle consistency helps regulate your body's natural circadian rhythm, sending clearer signals for when it's time to sleep and wake. Think of it as a gentle routine for your internal clock. Wind down for at least an hour before bed. This isn't just about turning off the TV. It's about signaling to your body that it's time to prepare for rest. This could include a warm bath or shower to relax muscles and lower body temperature, gentle reading, a calming book, not stimulating, soft music or gentle podcasts, nothing too engaging. Mindful breathing or light stretching to calm the nervous system, a cup of warm herbal tea like chamomile. Your bedroom should be a sanctuary for sleep. Ensure darkness with blackout curtains or an eye mask. Create quiet with earplugs or a white noise machine. Maintain a cool temperature around 60 to 67 F or 15 to 19. Is generally best for sleep. Invest in a comfortable mattress and pillows that support your body. Regular moderate exercise during the day can significantly improve sleep quality. Activities like walking, gentle yoga, swimming, or tai chi are wonderful. Aim for at least 30 minutes most days. Just be mindful not to exercise too close to bedtime, within 3 to 4 hours, as it can be stimulating. If nighttime urination nocturia is a concern, consider these gentle adjustments. Limit fluids to 2-3 hours before bed. Avoid diuretics like caffeine and alcohol in the late afternoon and evening. Be mindful of overly salty or oily foods, or certain nuts like peanuts, cashews, walnuts in the evening. Opt for bladder-friendly choices like soaked almonds or macana. Worry and anxiety are huge sleep disruptors. Incorporate gentle stress reduction practices into your daily life. To get worries out of your head, gentle prayer or meditation. Connect with loved ones to reduce feelings of isolation. What to avoid. Gentle reminders for better sleep. Avoid heavy meals close to bedtime. Aim for a light dinner at least 2 to 3 hours before sleep. Limit caffeine and alcohol, especially in the evening. Caffeine is a stimulant that stays in your system, and alcohol can lead to fragmented sleep later. Steer clear of screens before bed. The blue light from phones and tablets can interfere with melatonin production. Put away all screens at least an hour before bed. Resist excessive napping. While a short, refreshing nap can be lovely, long or late afternoon naps can steal from your nighttime sleep. Keep naps to 20 to 30 minutes and do them earlier in the day, e.g. early afternoon. Don't try too hard to sleep. If you can't fall asleep after 20 minutes, gently get out of bed, go to another room, do something quiet and calming like reading a non-stimulating book under dim light, and only return to bed when you feel sleepy again. Part 4. When to seek gentle guidance. While these tips can make a significant difference, there are times when it is wise to gently discuss your sleep concerns with a healthcare professional. Seek help for persistent insomnia, weeks or months of struggle. If you experience loud snoring or gasping for breath, it could be sleep apnea. Uncontrollable leg movements suggest restless legs syndrome. If you have excessive daytime sleepiness, despite enough time in bed, or concerns about medications impacting your sleep, consult your doctor. Any new or worsening sleep problem causing distress warrants professional advice. Your doctor can help identify underlying conditions, adjust medications, or refer you to a sleep specialist who can offer targeted solutions, like cognitive behavioral therapy for insomnia (CBT), a very effective non-drug treatment. Remember, seeking help is a sign of strength and Dear friends, as we gently conclude our conversation today, I hope you feel a little more understanding and a lot more hopeful about your sleep. Sleep changes are a natural part of our beautiful journey through life, but understanding these shifts empowers us to respond with love and wisdom. You deserve to wake up feeling refreshed, invigorated, and ready to embrace each new day in your golden years. It's not about achieving the perfect sleep of your youth, but about finding the most restorative and peaceful sleep possible for who you are now. By embracing consistent routines, creating a serene sleep environment, making thoughtful dietary choices, and gently managing stress, you are providing your body with the loving care it needs to rest deeply. May your nights be filled with peaceful slumber and your mornings with gentle light and renewed energy. Thank you for joining us today at Wellness Hub Seniors.